Welcome to part 2 of this introduction to homeopathy. The first thing I'm going to do is review a few of the principles that we talked about in the first session, and then we're going to go into the details about how you what you have to look for in acute case taking, and then look at some acute cases and some remedies. So, as I mentioned in session 1, homeopathy is a system of healing that actually supports what your vital force is trying to do. This is a lot like a support group. The homeopathic remedy resonates with your vital force and gives it what it needs to do what it's trying to do. And we went into a lot of detail on this in the first session. So I just wanted to remind you of that when we're working with homeopathy, we're working with the vital force, and we are stimulating a healing response, so that rather than just suppressing symptoms, we're actually causing the body to go into a healing mode, which has an overall effect of strengthening rather than suppressing the vital force. We also talked in the last session about the principle of like cures like. This was Hahnemann's hypothesis that he found worked, and basically a substance that causes a set of symptoms in a sick person, substances that cause some symptoms in a healthy person can cure those same symptoms in a sick person. In this example here that we have, somebody who's having trouble sleeping might benefit from the homeopathic remedy coffea. Coffea, of course, is made from coffee, whereas in a normal situation, in a material dose, if you drink a cup of coffee, it causes insomnia and keeps you awake. So like cures like. We also talked in our last session about how homeopathic remedies are basically, we know what they do through provings, and this is by testing the substances on healthy people. And the first time this ever happened was when Hahnemann tested quinine bark on himself to see what it did, because it was considered to be a cure for malaria. And indeed, it caused chills and fever when he took it. So this is how provings are done to this day. We take the actual substance ourselves, or sometimes the homeopathic remedy of or the homeopathic medicine, and see what it does to somebody who is healthy. Then there is the principle of dynamization, the fact that these homeopathic remedies are actually energy medicines, and they are prepared by a process of dilution and succussion, which I explained earlier. And by doing this, the energy of the actual substance is released, and so these remedies are free from side effects because they're actually an energy healing rather than a physical substance like a pharmaceutical drug. So now that we've had a small review of what we talked about in session 1, I'm going to discuss how a simple way to take an acute case with homeopathy. Now, one important differentiation that I should make here is that we really have two branches of homeopathy within classical homeopathy. One is acute prescribing, and one is chronic prescribing. Acute prescribing is for when you have a condition that has a beginning, a middle, and an end. For example, you catch a cold, or you have a bladder infection, or you get an injury, or you have a headache. So something that starts, oh, I'm getting a headache, and then you have the headache, and then later you don't have the headache. And that's the kind of thing that you can learn to treat at home. And it's also what we cover in much more detail than you would do at home in our Module 1 of the Caduceus program. So that is acute homeopathy. A chronic homeopathy is for what many people suffer from, especially adults as we age, things that either recur or are continuous. For example, arthritis, asthma, anxiety, depression, any symptoms that recur, autoimmune diseases, cancer. All of these things are chronic diseases, and you cannot treat them on your own. In our professional program, we do teach you how to do that in the more advanced modules. So we have a Module 1 that covers acute homeopathy, and you can become a really good acute prescriber. Some medical professionals take just Module 1 just so that they have medical doctors or chiropractors, so that they have something they can do when a patient comes in with an injury or an acute problem, poison oak, an acute bladder infection, acute sinus infection. That's the kind of thing that you can learn how to do in Module 1, and the kind of thing that we're going to be discussing right now in this introductory session. So I have here, it says St. MELS, S-T-M-E-L-S, and each of those letters is we are taking a case, and do that when we doing our investigations. Because, for example, if you take any acute condition, let's say a headache, because we're going to be looking at a headache case today, we have literally hundreds of remedies for headaches. So to know which remedy we need for a particular person's headache, we need to investigate, and we need to get a lot of detail and get very specific. So homeopathy is extremely individualized and requires that you become kind of like a detective and that you're able to investigate and really notice details. So the first thing we might ask, and again we'll use the example of a headache, is a side. Which side is it on? There's actually left-sided headaches, right-sided headache remedies. There are remedies for left-sided sore throats and right-sided sore throats. So the side which is bothersome is important to investigate. The other T is for time, and the time of day when the problem started or gets better or worse. For example, if somebody has had a headache for a couple of days and it gets much worse at 3 p.m. in the afternoon, then the fact that it's worse at 3 p.m., the aggravation time, or when it gets better, when it's ameliorated, which means when it gets better, to ask at that point. Would be the kind of questions we would. Modalities are extremely important. Modalities mean what makes it better or worse. And we have physical modalities and we have emotional modalities, because we're working with both. We're working with the mind and the body together. So physical modalities, for example, if you had a sore throat, does it feel better when you have cold drinks, or does it feel better when you have hot drinks? That's an example of a physical modality. Or if you have a headache, do you want to put cold compresses on it, or do you want to put heat on it? Do you want to lie down? Does it feel better when you're lying down, or does it feel better when you're sitting up? So the question that you would ask a family member or a patient would be, what makes it feel better or worse? Emotional modalities are also important because sometimes conditions come on are brought on or aggravated by getting angry. We have ailments from anger, ailments from grief, because emotions can also can be connected with getting sick. In the first session, I gave the example of my own flu when I was so excited about starting homeopathy school, and in the end, I ended up in a gelsemium state. Ailments from anticipation. Even being happy, ailments from joy. In fact, coffea, the homeopathic remedy made from coffee, is known for being good for when you can't sleep because you're so happy, like you just got some good news. So that's even good emotions can affect our vital force if they're too strong, and make it difficult to sleep or bring on a disturbance in the vital force. Another question we ask is, where do the symptoms extend to? For example, if you had a sore throat, it's possible that the throat pain extends to the ears upon swallowing. Or if you have, for example, sciatica, it could be that the pain extends down the leg. So where the pain extends to is an important question. So we can ask, does the pain or does the problem go anywhere else? Do you feel it anywhere else? The exact location is also important. It's usually not put in anatomical terms the way it is right here, but for example, we have headaches that are on the vertex. We have headaches that are frontal. We have headaches that are catarrhal, which means they're sinus headaches. Many different locations, even in the head, where somebody could be feeling something. So we want to get really specific. Can you show me exactly where it hurts? And then the sensation. What does it feel like? Is it a burning pain, for example, with a headache? Is it a pain like a throbbing pain, like something's hitting you with a hammer? Is it a cutting pain like a knife? So we want to know the exact sensation and have the person describe it to us without putting words in their mouth. The best thing is to always ask open-ended questions so that the person comes up with their own vocabulary for this. So again, yeah, burning, sometimes, burning pains, throbbing pains. There are dozens and dozens of different kinds of head pain, for example. But in many other kinds of ailments, we have many, many different kinds of pain as well that are described in our Materia Medicas. So here's an example of a case. This is a man who has a right-sided headache, so that's our side. It came on at 3 p.m., so that's our time. It's worse from being in the sun, so that's our modality, what makes it better from or worse. It's worse from light or from being jarred, which is another modality. It's better from lying in a dark room, another modality, and it's extending to the occiput, and it's located in the forehead, extending to the occiput, and the sensation, so the location is, so we've got them all here, extending to the occiput, located in the forehead is the location, and the sensation is pounding. It's a pounding headache on the right side from being out in the sun. So this is an example of a case where you've got all the factors that we talked about. There's the side, there's the time, there are 3 modalities, worse from being in the sun, worse from light and jar, better from lying in a dark room, extending to the occiput, located in the forehead, and pounding. Extending to the occiput is the extension, location is located in the forehead, and pounding is the sensation. Sometimes people will have more than one sensation, but we're just giving this as an example. So the remedy that would cover this case is, we have to find a remedy that has these same symptoms, because we're looking at like cures like, and the remedy is belladonna. So belladonna is known for causing a kind of sudden rush of blood to the head, which causes a great deal of throbbing and heat and redness. Children, in fact, my grandson needed belladonna last night. My daughter called me up and said that my grandson, Felix, his face was red and he had been sent home with 102 fever. And there were really no other symptoms, but this very sudden onset and the redness of the face, very often children in that state need belladonna. And so I told her to give him belladonna 200C because she has a kit at home. Very quickly his fever came down, he started eating, he looked less red, and he fell asleep, which is something that children often do when they take a homeopathic remedy that's working for them. He fell asleep and he was much better today after all of that. So belladonna covers very high fevers where there's delirium, can be right-sided complaints, as in our right-sided headache that we just talked about, worse at 3 p.m., which is, a hot time of the day because any kind of heat tends to make things worse. And also worse from washing the hair, because from the head getting cold, some kind causes this. Also worse from different kind of pounding headache and any kind of bright light, really bad light or any noise, that could be belladonna. Also hormonal imbalances. So it's a great remedy in hot flashes, PMS, anytime when the hormones are out of balance and might be causing headaches and hot flashes. There may be a desire for lemonade and the pupils may be dilated. In fact, the remedy belladonna means beautiful woman, and the reason it's called belladonna is that in Europe women would actually put a little bit of this herb. It's Atropa belladonna, and atropine is a drug that's made from it, but they would actually put some of this in their eyes to make their pupils dilate so that they would look more beautiful. So hot flashes, headaches, cramps, earaches, it's a good remedy for right-sided earaches as well. It's a very, very important household remedy. I think I mentioned in the first session about the ABCs of the nursery. Aconite, which we discussed in session 1, belladonna is the B, and then the C is chamomilla. That's an overview of them. Anyway, that's belladonna. So now we're going to actually go over another case of belladonna and identify some of the symptoms that are characteristic of belladonna. And I'm also going to show you how this is analyzed on a professional homeopathic database. So this is a case that was written up by a student of homeopathy. This was a 48-year-old female. She is extremely pale. Her eyes are bloodshot red, also red around the rims. She says very little, but her voice is strong. She keeps closing her eyes and laughs loudly and frequently. She holds very still. After a few minutes, she asks for an ice pack, which she then presses on the top of her head. So we have some interesting things so far. Apparently it helps a little. After the ice pack, her face flushes red. So we already have a little bit of a modality here. It's better from the ice. She wants to put an ice on it. Comment, it was an extremely smoggy, hot, and sunny day with no wind. She came in the late afternoon. So this was all happening in the late afternoon. She says, I have a terrible headache. She laughs. Don't worry, I wouldn't even notice if your house is messy. She laughs again. It's a stabbing pain from my back up through my head and around my eyes. When I went out in the sun this morning, I knew I would have a headache. The air was so bad. It's been coming on all day, and now I can't see straight. It's so bad. She laughs, and she laughs again. I just want to hold very still in the dark with an ice pack. So this is another modality. Her headache is better when she holds still, and her headache is better from ice. It's worse if I move. I don't even want to move my eyes. She laughs again. You don't seem irritable. And she laughs again. Oh, but I am. At work this afternoon, I felt I was going to burst when my partner was talking to me, so I didn't say anything. And she laughs. I feel like I'm burning up inside. So that's the case of. So I'm going to show you how we actually do this. All right, I'm just going to say this again because I think this slide, I'm not sure it recorded, but we're looking now at a homeopathic database, which is a cross-reference of symptoms. And this was put together over 100 years ago by James Tyler Kent and used to be done in book form. And this is how we find, with the literally hundreds of remedies that cover headaches, which headache remedy a person needs. We do it by cross-referencing the symptoms. And these days, homeopaths use this very specialized homeopathic database that has much more information in it than it did way back when. And also we can do it much more quickly. But if you take the course, for example, you'll start to learn how to do it by hand, because there's a real art and science to even knowing how to access this information. It's a very interesting process to learn how to look things up. So I'll just point out to you here, for example, this first, we call them rubrics, these different symptoms here. Each one is a rubric. The first one is head pain, sun, exposure to sun from. So basically what that means, this is a headache. Head pain is a headache. Head pain that was caused by exposure to the sun. And then the second one is face discoloration, red, headache during. So, her face had turned red after the ice pack. So we use that. That basically means her face was red during the headache. Vision dim during the headache, and this would be considered kind of like an extension, because it's not just the headache, but it's also extending to the eyes and her vision being dim, which is what she said. She said, I can't see straight, it's so bad. So it was affecting her vision. So that's vision dim during headache. Mind laughing. Now this is very interesting, because normally we would say, well, what does the laughing have to do with a headache? But the fact that she was laughing a lot, even though she was in a lot of pain, is a really, really important symptom. In fact, it's even more important. We call it, in homeopathy, a strange, rare, and peculiar symptom, because it's unusual that somebody would be in a lot of pain and laughing so much. So that kind of thing we find to be very important, because it helps us to narrow down the remedy. What kind of remedies laugh when they're in a lot of pain? So that's why we're looking up laughing here. The next symptom there is head pain, cold applications ameliorate. because she asked for an ice pack, and that's what she wanted to do, was just be there with an ice pack. So ameliorate means to make better, and cold applications is how we look up ice. And finally, head pain motion aggravates. She said, I just want to hold very still in the dark with an ice pack. So we're looking that up by, in this way, head pain motion aggravates. So you can see that we have 6 symptoms there, and they are in the form of what we call rubrics. A rubric is a symptom that we look up in this special book, which is called a repertory. And you can see here that the first remedy that is coming up is, it says, if you can see BELL above the number 1, that's belladonna. And so that you can see belladonna comes up very, very high in our analysis here. And you can also see that there are literally hundreds of remedies down the line. But, you know, for somebody who knows their materia medica, who knows their homeopathic remedies, they're probably pretty sure that this is a belladonna case, because it has many, many characteristics of belladonna. The etiology, what brought it on, which is the exposure to the sun, the fact with the red face, the laughing, the worse from motion, and the wanting the cold on it, etc. So I think hopefully that makes some sense to you, and you'll probably remember belladonna now for a very long time, I hope. It's a useful remedy, especially in hot weather, so maybe it's an extra important with climate change and so many areas of the country becoming more dry and more hot. We may need more belladonna. All right, now we're moving on to RHUS tox. This is another really helpful remedy. It's anybody with an injury, with arthritis, or any injury, where it's stiff and uncomfortable when you first get up in the morning, or when you first start moving it, and then it starts to loosen up and starts feeling better, so better from continued motion. But then after you've been using it too much, it gets worse again. So worse in the beginning of motion, or worse originally, you know, getting up in the morning, better with continued motion, and then gets bad again. That's why it's a rusty gait. It's like a rusty gait. You know, the first few times you start moving it, it's kind of rusted and doesn't move very well, and then it starts to move better. There's also a kind of restlessness, a lot of stiffness and soreness, a desire to stretch. Maybe come worse from cold and damp and getting wet. You can really see how arthritis and is covered with this, because people who have arthritic pains are often worse, you know, when it's cold and damp out. There may be a desire for cold milk. There may be a red triangle on the tip of the tongue. It's useful for a lot of different kinds of injuries, including whiplash, sprains. It can also be useful in flu, sciatica. It's a great remedy in sciatica, lower back pain, and, as I had mentioned, arthritis. So here is a case that actually comes out of the late 1800s, so a long time ago. This is out of an old homeopathic journal. A man sprained his leg in a harvest field. When he presented himself to me, he had exhausted the old school remedies. That was meant, you know, probably aspirin and things like that. Found a swelling about the size of half an ordinary orange just below the kneecap at the head of the tibia. Was very lame, worse during rest, at night, and before a storm, etc. A complete RHUS case. So he already recognized that this was a RHUS tox case, because it was worse after resting and also during a storm, before a storm. That's another indication for RHUS tox. Prescribed RHUS 30. In 5 days he reported no more swelling and no pain to speak of. He got but one prescription. He sent another man who had been hurt in the same field. He had sprained his ankle. The symptoms in this case were precisely the same as the other. It was, however, more of a recent occurrence and was located at the ankle instead of the knee, but still a clear RHUS case. I gave him the same as I gave the other, with the assurance to the patient it would cure him in a week. He came again not better. I was so sure of the remedy that I gave him the 3D of the same, must be a different potency. He reported in a week that the medicine acted like a charm. So yeah, RHUS tox, the first remedy you want to think of in an injury is arnica. But if it's a sprain, and if it's got that stiff soreness and worse when you first start to move it, you could definitely think about RHUS tox as well. RHUS tox, by the way, is made from poison ivy. So it also has an affinity for skin eruptions. All right, well, here is another important remedy, apis, which is made from the bee. You can see this bee with its little stinger there. And apis, you can know the symptoms pretty well by knowing what it feels like to get stung by a bee. It's swellings, it's stinging pain, it's burning pain. And those feelings could really be from an allergic reaction, from a sunburn, it could be in the eyes, it could be a sore throat with burning, stinging pain, it could be in the urinary tract and cause bladder infections. It can be in the joints as well, when joints get really swollen and red and have burning, stinging pains. The modalities associated with apis are being better for in the fresh air and for cold applications, because it's really hot and burning, and worse from heat and touch. So interestingly enough, because it's like cures like, not same cures same, apis is not the #1 remedy for bee stings. Usually for bee stings, ledum is more useful. But you can definitely remember that when there's heat and swelling and burning and stinging somewhere in the body, you may need apis. I have a really interesting case dated October 27th, 1877. This is another old case. The doctor was called in consultation with Dr. Gulick at Watkins, New York. Found the place passing through a very severe epidemic of diphtheria. This was before immunization, and people were still getting diphtheria. Every person that had been attacked, 40 in number, had died, and 4 were lying dead that day. Every physician of all schools had lost 1 or more. The homeopathic physician to whom I was called in consultation, a man of age, ability, and large experience, expressed himself thus: "Doctor, I am on my knees to anybody who can help me. 1 child had already died in the family to which I was called, and the second one was apparently well on the way to the same end." So this is a child with diphtheria, and you can see this was a very grave situation, and a very brave one also, that these doctors were going in to people's homes where people were dying and trying to treat them in spite of the risk to themselves. The girl was age 14 years, light hair, blue eyes, nervous temperament, had been sick several days. Looking into the throat, I found the tonsils and the uvula greatly swollen. The tonsils so much so that the throat was being completely closed down, and the uvula hanging, very much elongated and looking like a bag of water, which is an apis symptom. down the front of and against them. The whole throat presented a decidedly edematous appearance. Edematous means swollen up with water. Both tonsils were patched with a yellowish membrane with a ring of the same around the uvula. Breath exceedingly offensive. There was stopping of the nose. The breath could be heard across 2 large rooms. Swallowing was almost impossible on account of the great pain, which streaked up into both ears. There was prostration, meaning she was very, very weak. Restlessness with tossing about, sleeplessness, pulse 130, skin alternately hot and dry, and then perspiring very profusely, very characteristic of apis. Here was a case in which one remedy was clearly and perfectly indicated. The doctor had used belladonna, mercury, and other remedies which had served him well in previous epidemics, but they were no use here for the simple reason that the 2 epidemics were not alike, and different remedies were indicated. So this is another example of, a disease could need a different remedy depending on the exact symptoms of the patient. Apis 6th was given once in 2 hours with the effect of reducing the pulse to 100 in 6 hours and checking the progress of the whole disease at once, which improvement continued until complete recovery without sequelae. So the apis actually cured this case of diphtheria after, so many people had died in this epidemic. So this was really a remarkable case, and I think I may have mentioned in the first session that homeopathy really became so well known through Hahnemann's treatment of epidemics in the 1800s. He was so successful, and that's how homeopathy became famous, was treating these kinds of terrible epidemics: flu, typhoid, cholera. Now we're going to discuss another remedy, pulsatilla, which is a flower, the wind flower. And it's known, if you think of a kind of flower kind of blowing in the spring wind, in a spring breeze, that kind of gives you an idea of pulsatilla. I'm going to read you a little poem about pulsatilla. This is a book that a friend of mine wrote called Materia Poetica, Homeopathy in Verse. It's a medical doctor, Sylvia Chartreux, who wrote a book of poems about homeopathy, homeopathic remedies. Like a flower in the wind, I can sway and I can bend. Noses run and tears do too. Discharge is the thing I do. Do you love me? I'm unsure. Show me, tell me, I need more. As a child I held on tight to Mama's bed I went at night, soft and plump and often shy, no surprise to see me cry. One thing that's a little odd, I get stiff if you mention God. I love pizza, lots of cheese, open air, a welcome breeze. Stuffy rooms can make me sneeze. Drinks are not the thing I need, dairy is my favorite seed. Female problems suit me well, menstrual cramps and breasts that swell, menopause and pregnancy, coughs that will not let me sleep, and when the sunlight leaves the sky, my flower blooms and I could cry, pulsatilla is my name, forever changing is my game, is my fame, sorry. So soft and changeable, considered to be like an April day, being happy one moment, crying the next. But if there's a lot of crying, often think of pulsatilla. It's a little, another image for pulsatilla is a little child who wants to be held and comforted all the time and is always saying, Mommy, do you love me? They're looking for sympathy, they're looking for attention, they're looking for hugs and cuddles and love. They may be worse from a stuffy, warm room and feel better, want to be outside in the open air. This desire for butter, cheese, cream, these rich foods. So it's a great remedy for children, but also a great remedy in menopausal conditions, earaches, headaches, cough. Many, many different kinds of ailments actually respond to pulsatilla. Could be almost anything if these other characteristics fit. So here is another case, old case. This is the case of shooting pains in a farmer's wife. Mrs. G, age 35, a farmer's wife, called to get some medicine for neuralgia, stating that the whole right side of her head was involved. The pains would come and go gradually at very irregular periods. Remember, pulsatilla is very changeable. Shoot into the ear along with the side of the neck and under the eye, and was always made worse by putting anything cold in the mouth. To the question if the pain was relieved by putting anything warm in the mouth, she answered, "Oh no, that makes it a great deal worse." So it was worse from putting things both cold and warm in the mouth. Those are some modalities. The pains, although mostly confined to the right side of the face, were moving about frequently, and these wandering pains are very characteristic of pulsatilla, having pains that move around. Often after leaving the head, appearing in the left leg or heel, she was always chilly, easily moved to tears, and felt decidedly better in the open air. So this weepiness and wanting to be out in the open air. I gave her pulsatilla 32 powders to dissolve in 1 and 4 teaspoonfuls of water, and to take one every 2 hours. The neuralgia was cured with the first powder and remained so. She had no need of the second. So typical pulsatilla case, wandering pains, weeping, and feeling better in the open air. All right, next we're going to talk about a remedy that is probably the most typical remedy for Americans, which is nux vomica. And if you received my newsletter, you may have received the information about nux, because I think everybody who works in our society or lives in our society at some point gets into a nuxy situation. It basically often comes on from overwork. And when you're in that state where you're just working really hard, and in the morning feeling all groggy and needing to drink a whole lot of coffee to wake up, and then at night using alcohol to try to relax again. So it's the state of the nervous system which is just overwrought and being thrown back and forth by alcohol, by coffee, by drugs, overuse. It's a great hangover remedy, and abuse of any kind of substance, where your nervous system, just can't take it anymore. The typical story that's told in the old traditional materia medicas is that the businessman gets so impatient that he's trying to unbutton his shirt, and he just rips it open, and all the buttons fly off because he doesn't have the patience to unbutton his shirt. So you become, very oversensitive. There's a lot of spasming and cramping that gets involved too, because everything kind of goes into the spasmodic quality. It's made from a nut. Nux vomica actually means the nut that makes you vomit, so it has this spasmodic quality to it. It contains strychnine, the actual substance, but of course, as a homeopathic remedy, there isn't any actual substance left. It's good for chemical sensitivities, for flu, PMS, headaches, ulcerative colitis, allergies, ulcers, of course, ulcers coming along with, a lot when people are stressed. So here's a more modern case. This is not one of these ancient cases. John was an executive in a busy manufacturing company. His wife described him as a workaholic and said the family had to beg for time with him. John had a reputation for getting the job done no matter how difficult. His colleagues, while respecting his abilities, knew him to be irritable, impatient, and intolerant of those who did not perform to his high standards. John did everything quickly, sometimes too quickly. He was on the verge of losing his driver's license from speeding fines collected in the previous year. He found it difficult to stay within the speed limit or behind cars ahead of him. He had to be in front. This is, again, Nux is very competitive. He did many things to excess. He used stimulants such as coffee to keep him awake, and when it came time to relax, he did that in a big way too, with 1 or 2 bottles of wine. As a result, he suffered frequent hangovers, which gave him a fuzzy head and increased his irritability. Indulgence in spicy, fatty food, which he loved, would produce gastrointestinal complaints, such as nausea, bloating, or diarrhea. John was prescribed the homeopathic remedy Nux vomica. It perfectly matched his personality, behavior traits, and physical symptoms. He took his first dose following a hangover. Within minutes, his head began to clear and the sour feeling in his stomach resolved. He was very impressed. Ongoing treatment saw improvement in his digestive complaints and the migraines that had plagued him since his teenage years. John's workaholic tendencies, irritability, and drive all began to even out, a blessing to his family and work colleagues alike. So I'm sure many of us recognize this in ourselves and in people around us. Nux is truly, a 20th century remedy, especially for Americans. We really suffer from overwork and impatience and too much coffee and then too much alcohol and all of that kind of stuff. I'm going to talk a little bit now, and by the way, I will be giving some time for questions at the end. I want to talk a little bit now about if you're using homeopathic remedies. Using them, this is the boron food store, and they'll look something like this. On blue tubes, and there are little pellets in inside these blue tubes. You actually turn these little tubes upside down to dispense the pellets, and you twist the cap, and they come in different potencies. And what I would suggest is, if you want to use a homeopathic remedy and you're not really sure if it's the right one, then it's better to stick with a lower potency like a 6C. You also should not repeat a remedy if it's not helping. For example, let's say you have a headache and you think you might need belladonna. You can get the belladonna and try it once, maybe wait a half an hour and try it one more time, but don't take it repeatedly. The reason for this is if you're taking a remedy that you don't need, it could actually cause a proving. If you remember earlier in this session, I talked about homeopathic provings. That's when you take something that you don't need and then it produces the symptoms of, so it's probably unlikely in an acute situation that would happen, but it's still not a good idea to take remedies if you're not sure that you need them. So you can try 1 or 2 doses of a homeopathic remedy in a 6C if you can get it, that's a lower potency, or a 30C if you can't get a 6C. A higher potency would be a 200C. And then here you can see 30X. The X potencies are also lower potencies. So in general, I would say look for a 6C if you're not sure, but a 30C may also be okay. And when you're taking homeopathic remedies, you want to avoid drinking coffee. You want to avoid using a lot of strong-smelling oils, such as Vicks VapoRub or Bengay, or essential oils like eucalyptus or tea tree oils, because those might antidote the remedy. You also don't want to keep homeopathic remedies near your cell phone or expose them to X-rays if you can avoid those things. That's also a good idea. So those are a few quick tips about using homeopathic remedies. Before I take questions, I'm going to go a little bit into our homeopathic distance learning program. This is a complete professional program in classical homeopathy from start to finish. And as I mentioned earlier, we have a module just for learning acute homeopathy, which is basically a 6-month course. It's self-paced. which means you can start anytime and you can take as long as you need to do the course. But most people complete this first module, which teaches you how to do this acute homeopathy. They finish it in about 6 months. So the skills that you learn in, for example, Module 1 is you learn how to take a complete case. I gave a little bit of an overview today, but we go into much more detail about it. How to take the case, how to analyze the case, how to repertorize the case, which means look it up in that symptom index, how to differentiate between the different remedies that come up, how to choose a homeopathic potency, and then how to observe how the case evolves. So there's a whole process that you learn in Module 1 about acute homeopathy. And then in chronic homeopathy, the advanced modules, modules 2 through 5, you learn how to do the same thing on a chronic level for chronic conditions such as asthma, depression, anxiety, autoimmune conditions. Things that go on and don't resolve. We study homeopathic philosophy, which gives us the foundation and the basis to practice homeopathy. I talked last session about the Organon of Medicine, written by Samuel Hahnemann in 1810. We study this in a lot of detail in our program, and we study other classic texts as well that give us a real grounding in thinking like a homeopath. Therapeutics. We go into different therapeutic topics and study a group of remedies based on their affinity for certain parts of the body. For example, we have a whole session on gastrointestinal problems, nausea and vomiting and things like that. We have another session on respiratory problems that goes into coughs and flus. We have a session on pregnancy and childbirth, and we have a session on skin issues. And so in each of these particular sessions we go over remedies that are specifically for that area of the body, and we also integrate that with casework. We look at cases around that and how to use the repertory, and find those things in the repertory, and and the remedies. So the whole thing is integrated together. Everything that you need to know to treat a particular condition, we do step by step. Yes, we study the materia medica, the remedies. Some of them we study in a great deal of detail. The ones that are called polycrests, which are the remedies that are used very, very frequently. We go into a lot of detail. And then other remedies that have a smaller sphere of use, we study in less detail. But there is a lot to learn, and once you start the process of learning remedies, it becomes easier and easier because you are able to compare one remedy to another and say, oh, this remedy is like pulsatilla, except it's hot instead of chilly, for example. So the more you learn, the easier it becomes. You already have a framework to hang your knowledge on. So I'd like to invite you all to consider our program, Module 1, or the whole program. You can look at our website, www.homeopathytraining.org, and see more details about how the program works. You're also welcome to contact me personally if you have any specific questions about how it works, or whether this might be the right thing for you. So I'm going to check in and see what's going on. If anybody